Radiation therapy is common, but fewer people know about proton therapy, a more precise way to target cancer cells while sparing healthy tissue. So we're going to learn more about that, who might be a good candidate, and how patients can take the next step to learning more. We're so happy to be joined today by Dr. Kosj Yamoah, and he is chair and senior member of the Department of Radiation Oncology at Moffitt Cancer Center. So great to have you today.
Thank you so much for having me. We are truly excited to be bringing this novel FDA-cleared proton therapy system to the Tampa Bay area. This is truly a world-class innovation and technology that will be available for patients with cancer in the Tampa Bay area and globally.
That's exciting news. I love what you do at Moffitt. I know you're at the forefront of technology and new treatments. So a lot of people are familiar with radiation therapy, but not so much with proton therapy. So what are the differences, or I should say, what makes it unique?
Absolutely. So proton therapy has been used for years, and it's really a very innovative approach to treat cancer because it's a lot heavier than the conventional photon, which is able to deposit dose to tumors, but it also has a pass-through effect that makes it have more side effects. And so proton therapy, unlike traditional radiotherapy, is able to stop right at the tumor edge and doesn't go beyond that. And so what that means is fewer side effects for patients, and with that fewer side effects, you get a smoother recovery time. But the technology that we are getting takes it to the next level because it's actually more precise. It's also able to really deliver it in a faster way and more accurate. And so collectively, patients spend less time at the hospital, more time with their families, and the treatment is more effective and the recovery is much, much better.
Oh, that's a great effect of that too, a result of that, I should say. My wheels are turning as to all the different types of cancer where that might be applied, and how you could save, like you said, keep the healthy tissue that you don't want to harm. Right. And so I want to ask too, who is a good candidate for this?
Yeah, so, every patient is different. It's like everyone has a different fingerprints and thumbprint, right? And so is also the utilization of proton therapy for patients. Proton therapy is excellent for tumors that are in very delicate areas and high traffic areas like head and neck and different areas of the body in the spinal cord. But it's also not good for every type of tumor. Maybe tumors in areas that are moving a lot, like the lung, or areas where there's a lot of air cavities around it and things like that. Those are not so much the best use case for proton therapy. And so really at Moffitt, what we do is to have a multidisciplinary evaluation of the entire patient and the tumor type and determine what's best. So we have technologies that allows us to treat tumors while they are still in motion, and others are able to really deposit tumors in specific areas. So it's really a patient-physician conversation to know if proton therapy is right for you.
Right, to know if you're a good candidate, and depending upon the type of cancer that someone may have, of course. And what about, doctor, can you elaborate on what someone needs to do if they're hearing us talk about it now and saying, I think I might be that good candidate? What steps should they take?
No, if you have a cancer diagnosis, really the best thing to do is to call or even go online and schedule an appointment. And we have teams, not only radiation oncologists, we have medical oncologists, surgeons that are all focused on special disease sites that are really, that's what they do. And we're able to provide an arsenal of technology and novel treatments that is available and right for our patients.
That makes sense. And just a side note, this is a reunion for us. I had the pleasure of interviewing you years ago, and as my family, as friends have gone through battling cancer, I've thought of you. And of course, the fine work that you all do at Moffitt. It's incredible. We're so lucky to have you here in the Tampa Bay area. And for our viewers who want to find out more, you can see the information on the screen. Find out about proton therapy, if that's the right fit for you or a loved one. Thank you so much.
Thank you so much for having me.